Well, hi, Dr. Halasa.
Hi, Tracy. How are you today?
Good. Well, here we are in your beautiful Endodontics office in Rancho Mirage. Can you tell me what an Endodontics office is?
Well, Tracy, Endodontics is a specialty in dentistry that deals with root canal procedures. Endo means inside in Latin, dontics, which means teeth. It's treatment inside the tooth. Our main goal is to deal with infected nerves, and we clean them, we remove them, we disinfect the tooth, and at the end results, the idea is to save your natural tooth.
What are the symptoms of a root canal?
One of the most classic symptoms of root canal therapy is it starts as sensitivity to hot and cold, also pain or sensitivity on biting and chewing, okay? All these symptoms starts simple and small like that, but if left untreated, it will escalate into a bigger problem where you see people having constant throbbing pain. Basically, they cannot tolerate chewing or using that side or that certain tooth. And this is where you know that the nerve is infected or inflamed, and that's where you know that definitely you need to seek help as to see an endodontist so that we can save the tooth for you. Hi Tracy, how are you? Please allow me to explain to you what's the root canal procedure, okay? So after we establish a full anesthesia, basically we numb you completely. Root canal, I promise you, there should be no pain during root canal procedure whatsoever. So first of all, I want to show you the anatomy of the tooth. This is the enamel, and this is the dentin layer, and this is the nerve. A lot of people think that when we do root canals, I get questions from my patients, say, are you going to remove the root? Actually, we remove the nerve, which is that red tissue in the middle. The root, which is the tooth structure, that stays, and this is what keeps your tooth inside the bone. So imagine if you have an infected nerve here. The aim of the root canal procedure, again, after we numb you, no pain, we go access the tooth from the top, and we go through all the way down to the end of the root in order to remove the entire infected nerve. Now, once you do that, you are dealing with bacteria and germs that are still inside the canals. So in order to get rid of the bacteria and the germs, we use antibiotics, mostly liquid antibiotics that we inject inside the canal space, and that should definitely disinfect and kill the bacteria. But now we have an additional method to add more to disinfecting and killing the bacteria. We use laser technology. And let me show you, please, what we use here with this laser. This photo beam laser technology, simply after we clean the canals, we initiate the laser inside the canal spaces, and the laser therapy or the laser energy will do two things. It will create like a tsunami movement in the antibiotics that will penetrate deeper into the canal space and kill all the bacteria and the germs that are hiding inside all the way to the end of the root. Also, the laser itself can kill and disinfect bacteria and germs. So this technology will definitely aid in reducing the infection and help saving your natural tooth. And that's called laser endodontics.
Is root canal therapy painful, and what could someone expect during and after the procedure?
It depends on the condition that the patient comes in, okay? But in general, 99% of root canal procedures, during the procedure, there is no reason for the patient to be in pain during the procedure, because we here at Rancho Mirage Endodontics, we not only, of course, use local anesthesia to numb you. That's why I said no need or no reason for you to be in pain during. Also, we provide in the office, we provide IV sedation. We put people to sleep basically in order to do this procedure, especially when we do surgeries. We provide oral sedation also, where we give you pills before or during that will also relax you. We use also nitrous oxide, or what we call the laughing gas, that also help to relax the patient during the procedure. So there is no need again for any pain during the procedure. So all this can be done painless. Okay. Now, after the procedure, it depends on the level of infection you have before. And what we do in the office here, we provide post-op care, post-op medications that will help reduce this post-op discomfort, including antibiotics, painkillers. And again, not every root canal procedure should have pain afterwards. It depends on the infection that the patient comes into the office before. And that's how it works, basically. But regardless, root canal procedure should be a very comfortable procedure to do with absolutely no pain at that level.
So why do I need to see an endodontist?
Well, the endodontist is a specialist that have more training and went to extra schooling to be able to do this procedure. First of all, endodontics is an accredited specialty by the American Dental Association. And after you finish dental school, we go an additional at least 2 to 3 years in a graduate program to learn how to do root canal procedures. And we do also surgeries that are focused on removal of infections from the jaw, from the mouth, and all that. So in order to save the teeth. Plus, an endodontist also, in additional to the training, we use equipment that help us to remove the infected tissue, okay, the infected nerves. In endodontics or root canal therapy, we're dealing with a very, very, very small nerves. And most of the time the problems I see in the office with patients coming in, that nerves are not being removed completely from the tooth, or we call it missed canals, meaning there are other nerve tissues that are left in the tooth, and that could lead to pain after the procedure. But in endodontics, we use, in the office in Rancho Mirage Endodontics, we use equipment that help us, like the surgical microscope that will allow me to magnify inside the tooth up to 25 to 30 times to see what's going on. Also, we use laser therapy, and the laser is absolutely amazing tool in order to go and clean the nerve tissue completely and disinfect the canal. Also, we use technology like CT scan, CBCT, or cone beam CT scan. That CT scan will not only allow me to see the anatomy of the nerves. This way I don't miss a canal, we don't miss canals, we see where the canals are. Also, I will be able to find infections in your jaw that these infections will not appear or show on the regular x-ray that general dentists have. And this way we can treat it earlier than waiting until it become a bigger problem. So being in an endodontics office, you definitely have all the tools and equipments and the training to treat the infection appropriately and save the natural tooth, basically.
Is root canal therapy a permanent procedure?
The idea of the root canal therapy is to seal the canal space, meaning when we remove the infected nerve, inside the tooth there are tunnels, or what we call canals. So when we go in and clean and disinfect with antibiotics, and we use laser, and after we're done, we seal the canal space. And the idea of sealing the canal is to prevent bacteria and germs from passing through again and infecting the tooth one more time. So to answer your question, Tracy, it is a permanent procedure. Root canal therapy can last for 30, 40 years if done right. And also, I want to really important to understand that not only the root canal therapy is also having a general dentist that is also involved, that he can put the proper restoration on the tooth, meaning after we're done, you can put a crown or a filling on the tooth that will seal it properly. This way germs and bacteria cannot go again in the tooth. So yes, root canal therapy is meant to be a permanent procedure, basically.
Why do I have to go to the general dentist after the root canal?
Well, the general dentist is also a part of the team. We work as a team. Most of our referrals, or what we call general dentist referrals, they send the patient to us to do the root canal procedures. An endodontist is not a general dentist, so we don't have the ability to do crowns or fillings and restoring the tooth. I mean, we can, but to a certain limit. That's why after the root canal procedure, we really want to have a relationship with the referring dentist, so the patient expect to go back to the dentist so they can put the permanent restoration. We call it a crown, which most likely we prefer to have crowns on the teeth that already have root canals, because crown will prolong the life of the tooth after the root canal procedure, prevent fractures and all that. So this is important to understand. After the root canal procedure, definitely 99% of the time you have to go back to the general dentist so they can put the final restoration on the tooth.
If I don't want to do the root canal therapy, what other choices do I have?
When we're dealing with an infected tooth, okay, which most root canal procedures dealing with infected teeth, you don't want to have an infected tooth in your mouth untreated. That's the worst thing you can do, because as I said, this is not going to stop. It's going to keep going. The idea of the root canal is to save the tooth. But if you don't want to do this procedure, then the other option you have is to extract or remove the tooth at this point, okay? And this can be done by an oral surgeon or a periodontist or your general dentist. But this is the alternatives of not doing a root canal procedure, is simply to remove the tooth and not leave it as is.
If I don't want to do the root canal therapy, what other choices do I have?
I want to tell you, Tracy, there's one more thing that I see a lot in my patients. And this is a very important message that everybody should know, that in dentistry, having no pain is not always a good thing, because we're dealing with two types of infections. Either we have chronic infections that are completely painless, and we discover those on the CT scan that we take, and definitely I see infection, I see bone destruction, and the patient is completely unaware of it. And that's called chronic infection. Versus acute infection, where you see people coming with swelling, severe pain, and both of them needs treatment. So that's why I always encourage my patients, that I always tell them, if you have no pain, that doesn't mean everything is good. Sometimes you have those hidden infections. So it's really important to come to to visit your general dentist every 6 months, every year, for a checkup, or you can come to an endodontist and we can do the CT scan on you, imaging, to do a full scanning and look for these infections at this point. But definitely the alternative is to do treatment and not leave infections as is. That's not something you want to do.